Multiple Sclerosis by Nick Martin. What is multiple sclerosis? Multiple sclerosis is a progressive, inflammatory autoimmune disease of the central nervous system affecting approximately 400,000 people nationwide. While the etiology remains a mystery, multiple sclerosis is characterized by nerve demyelination, which is the destruction of myelin sheaths on the axons. In this case, autoreactive T cells cross the blood-brain barrier and initiate an immune response against the myelin. As the myelin sheath deteriorates, plaques form which develop into permanent scars that impair nerve transmission and may result in axonal death. The picture below shows two different axons with myelin on them. The left is a healthy myelin sheath and a healthy axon, while the right is a scarred myelin which probably has a much slower electrical transmission through it. The importance of myelin. Myelin is an insulating layer of proteins and fatty substances that form around nerves of the brain and spinal cord. Myelin allow action potentials to jump between gaps in the sheath. These gaps are known as nodes of Ranvier and allow electrical impulse to travel quickly and effectively. The picture on the right shows two different types of axons, one myelinated and one unmyelinated. The myelinated axon has action potentials jumping from node to node at a much faster rate. The unmyelinated axon does not have any kind of myelin on it, and the action potentials are forced to travel down the axon at a much slower rate. Signs and symptoms of multiple sclerosis. Signs and symptoms differ from person to person depending on the area of central nervous system where demyelination is the highest. Symptoms may be moderate to severe and can go away quickly in a couple of days or last for months. The most common early indication of multiple sclerosis are visual impairments such as blurred or double vision. When one shows symptoms of multiple sclerosis, it is known as attack or exacerbation. Recovery from these symptoms are known as remission. A return of symptoms are referred to as a relapse. Signs and symptoms of multiple sclerosis, more so in the early stages, include weak or stiff muscles, which generally affect the lower extremity more than the upper extremity. Muscle spasticity may also occur, which refer to muscles that are stiff or go into spasms without warning. Also, tingling sensations in arms, legs, or face, bladder control problems, clumsiness, loss of balance, and dizziness, which can make walking difficult, and assistive devices may be needed to prevent falling. Some signs and symptoms later on in the disease include mental and physical fatigue during activities of daily living. This is defined as an overwhelming sense of tiredness and is the most common and rated worst symptom by people with multiple sclerosis. Physiological disorders such as impaired cognitive ability, memory loss, and depression are also prevalent. There are three different clinical courses which have been clearly identified in multiple sclerosis. They include relapse-remitting, primary progressive, and secondary progressive. Relapse-remitting multiple sclerosis is the most common disease course and is characterized by clearly defined attacks followed by periods of partial to complete recovery. During the remission stage, there is no progression of the disease. Attack symptoms may go away completely or significantly lessen. This graph shows the process of multiple sclerosis over time, and you can see that there's plateaus which allow for a decent amount of time for remission and those symptoms to kind of go away and for the patient to recover. Primary progressive multiple sclerosis is characterized by the constant worsening of neurological function with very little or no remission. The clinical status continually worsens. On this graph, you don't really see a lot of those plateaus, which mean there's really no point or time for the person to go through remission or recover from those symptoms. The disease is constantly progressing and constantly getting worse. Secondary progressive multiple sclerosis initially follows a relapse-remitting course. It starts with remissions and relapses, but eventually develops into a steady progression with little to no remission. Many people who are initially diagnosed with relapse-remitting multiple sclerosis transition to secondary progressive multiple sclerosis. This graph is the combination of the two previous graphs shown on the two previous slides. At first, there are those heavy attacks followed by times of remission, which can be shown by the plateaus and whatnot. However, as the disease progresses over time, the progression picks up and there's really no time for remission or recovery from those symptoms. The disease continually gets worse. So who's at risk? Diagnosis of multiple sclerosis generally occur in Caucasians between the ages of 20 and 50 years old. Women appear to be diagnosed at almost twice the rate of men and make up more than 60% of those living with the disease. While it is still unknown exactly what causes the disease, it is assumed to be a combination of genetic, infectious, and environmental factors. Studies show that those who have relative with multiple sclerosis are at a higher risk for developing the disease. Some scientists believe that multiple sclerosis is triggered by an infectious agent such as the herpes virus. It has also been observed that there is a higher prevalence of multiple sclerosis in the northern regions of Europe, United States, and Canada. This map kind of just shows exactly what I said on the previous slide. You can see that Canada, the United States, and Europe have a much higher prevalence for multiple sclerosis when compared with countries across the world. The diagnosis of multiple sclerosis. There is not one test used to diagnose multiple sclerosis. Instead, doctors use several different tests to rule out or confirm the diagnosis. These tests include medical history evaluation, a physical examination, neurological examination, and an MRI scan of brain or spinal cord. The picture below shows what multiple sclerosis would look like on an MRI scan of the brain. It is pointed out by those 3 white arrows, and as you can see the white little spots, which are the lesions in the brain. Management and medication for multiple sclerosis. While there is no cure for multiple sclerosis, there are treatments, medications, and therapies used to improve symptoms and slow the progression of the disease. Some of the common medication used to treat multiple sclerosis are injectable beta interferons, such as Avonex and Rebif. Interferons are signaling molecules which help regulate the immune cells. Occupational and physical therapy are also used to improve mobility, motor function, and quality of life. Multiple sclerosis response to exercise. Each person affected by multiple sclerosis reacts differently to exercise depending on the severity of their symptoms. Those who are not exhibiting symptoms are able to perform standardized or slightly modified aerobic and resistive activities. Those who exhibit more serious symptoms have a much greater response to exercise and should be monitored. People suffering from multiple sclerosis may report symptomatic fatigue, in which case strenuous activities should be avoided to prevent worsening of symptoms. It is also important to monitor core temperature due to the problems with thermoregulation. Controlling the room temperature or cooling with a fan are important. Case study. In my case study, Claire is a 45-year-old female with a BMI of 21 that suffers from secondary progressive multiple sclerosis. She is sedentary, a non-smoker, no family history of heart or metabolic diseases, a blood pressure of 125/86, and a total cholesterol level of 210. She's also currently taking Avonex for her multiple sclerosis. Her overall goal is that she would like to regain motor function and improve her quality of life. Risk stratification. Overall, I decided that she is going to be at moderate risk. Because of this, she is sedentary and her total cholesterol levels are over 200, and that is why she's at moderate risk. It is also important to note that her medicine, Avonex, has side effects of dyspnea, headaches, and fatigue. And due to her clinical course of multiple sclerosis, she fatigues at a much faster rate, and her body temperature must also be monitored. Exercise testing. A supervised max cycle ergometer test is performed to determine her maximum functional ability since she fatigues at a much faster rate than normal. This protocol includes a 1 to 2 minute warm-up, followed by workload increases of 15 watts per stage. Each stage lasts for 2 minutes or until steady state is reached. The test concludes when she is too fatigued to continue. It is important to monitor her blood pressure, heart rate, and rating of perceived exhaustion, RPE, to get her specific maximum values. Exercise prescription. Because Claire is just beginning an exercise program and her multiple sclerosis related symptoms, she should start out at low intensity and duration for both cardiorespiratory and strength training. For cardiovascular training, she should start with 3 times per week, progressing eventually to 5 days per week. It should start at light intensity at first, an RPE of 10 or 40% of her VO2 max, and eventually progressing to more moderate intensity of an RPE of 14 or 60% of her VO2 max. She should start with at least 30 minutes per day, and if needed, doing about 3 bouts of 10 minutes with rest between each session. It does not have to be continuous 30 minutes of exercise, as long as she gets a total 30 minutes in those 3 days per week. A good type of cardiovascular training would be cycle ergometry, walking outdoors or on a treadmill at a brief pace, and swimming. For strength training, muscular strength is critically important for mobility and independence for those suffering from multiple sclerosis. Resistive training should use resistive movements and focus on the major muscle groups, in particular upper and lower body. She should resistance train for at least 2 days per week, alternating upper body on one day and lower body on the next. Her resistance should be set at a weight that allows for one set of 8 to 10 repetitions. Claire should be lifting for about 30 minutes, and if fatigue increases, the rest should be increased from 2 to 5 minutes. The types of exercise she should do for lower body include squats, lunges, leg press, and heel raises, and her upper body routine should include bench press, rows, lat pull down, and shoulder press. It is also important to include balance training. Regaining balance is important for those suffering from multiple sclerosis because it makes it much easier to do activities of daily living. Balance exercises should be done at least twice a week. These exercises include balancing on one foot for 10 seconds and repeating it 10 times on each leg, walking toe to heel in a straight line, and doing leg raises to the back and side 15 times with each leg. If needed, support should be provided in order to maintain balance and complete the exercise. It is also important to include flexibility training. Because people with multiple sclerosis have a reduced range of motion in some joints, it is important to include a flexibility program to counteract muscle spasticity and increase muscle length. Stretching should be done every day, not including before and after exercising. The stretches should be gentle and slow up to the point of mild discomfort without pushing it or tearing anything because you don't want to cause another injury. Each stretch should be held for about 30 to 60 seconds twice, and the stretches should focus on all of the major muscle groups, both upper and lower body, and light massages and yoga are another alternative that can help increase or maintain flexibility. Overall, multiple sclerosis is a progressive nervous system disease without a cure that affects thousands of people. Studies have shown that the earlier one begins an exercise program, the more likely they are to slow down the progression of the disease and alleviate some symptoms. The overall goal of these workout plans are to maintain or increase physical and mental health, mobility, and overall quality of life. Here are my references, and thank you very much.